Did you know that doctors possess an uncanny ability to instantly spot serious health problems simply by observing subtle hygiene slip-ups in their older patients? These seemingly harmless habits could be silently screaming warnings about dangerous conditions brewing within your very body right now. What's truly alarming is that most seniors are completely unaware they're making these critical errors day in and day out. In the next few moments, I'm going to reveal the 7 personal hygiene blunders that doctors immediately flag in their elderly patients, and how rectifying them could literally save your life or the life of someone you cherish. The information I'm about to share with you isn't taught in schools, rarely discussed in doctors' offices, and almost never mentioned in health magazines. Yet it could be the deciding factor between enjoying your golden years in robust health or suffering from preventable conditions that steal your independence and dignity. Let me introduce you to Walter, a 75-year-old retired engineer who believed his personal care routine was absolutely fine. Walter was an active member of his community, played 18 holes of golf twice a week, and never missed his grandkids' Little League games. During what he thought was just a routine checkup, his doctor immediately noticed 3 critical hygiene mistakes that indicated Walter had been developing a serious condition for months without even knowing it. I had no idea. Walter later confessed to me, "I genuinely thought I was taking good care of myself. If my doctor hadn't picked up on these seemingly minor hygiene issues, I might not be here today to share my story." Today I'll break down exactly what those mistakes were so you can steer clear of Walter's frightening experience. But more importantly, I'll tell you precisely what to do instead. Simple tweaks that could tack years onto your life starting today. Mistake number 1, neglecting oral hygiene. When was the last time you really scrutinized your toothbrush? Is it frayed and worn out? Are you brushing thoroughly twice a day? And here's the crucial question. Did you know that poor dental care isn't just about bad breath or losing teeth? It's directly linked to heart disease, stroke, and even dementia. Geriatric specialists at Harvard Medical School have irrefutably proven that bacteria from untreated gum disease can infiltrate your bloodstream and trigger life-threatening heart conditions. In fact, their research demonstrates that seniors with poor oral hygiene are 3 times more likely to develop cardiovascular problems than those who maintain proper dental care. But don't just take my word for it. Let me tell you about Beverly, a 68-year-old retired school teacher from Oregon. Beverly ignored her bleeding gums for months, dismissing it as a normal part of aging. "I just figured that's what happens when you get older," she explained. But during a routine physical, her cardiologist discovered dangerous inflammation in her heart, valves directly caused by oral bacteria that had traveled through her bloodstream. The doctor informed her that had she waited just a few more months, the damage might have been irreversible. What should you do right now? First, examine your toothbrush. If it's older than 3 months or showing any signs of wear, replace it immediately. Ideally, switch to an electric toothbrush, which according to studies at the University of Pennsylvania Dental School removes 62% more plaque than manual brushing. Brush twice daily for a full 2 minutes each time. Set a timer if you need to floss every single night without fail, and never skip your dental checkups even if you have dentures. Have you noticed any bleeding when you brush? Any swelling in your gums? These aren't normal signs of aging. They're urgent warning signals. Your body is sending you. Don't ignore them for another day. Mistake number 2, infrequent bathing and skincare. How often are you bathing? Be honest with yourself. Many seniors reduce their bathing frequency as they age. But did you know your skin is your largest organ, and changes in its condition can reveal serious internal problems before other symptoms even appear? Dermatologists from the Mayo Clinic have cautioned that reduced bathing frequency in seniors often masks early signs of diabetes, liver problems, and cardiac issues. Their clinical studies reveal that nearly 40% of undiagnosed medical conditions in elderly patients could have been caught earlier through proper skin observation. Consider what happened to Carl, a 77-year-old retired postal worker from Michigan. Carl thought bathing once a week was sufficient, especially during the winter months when his skin felt dry. "I didn't want to dry out my skin," he explained. But when his physician noted unusual skin discoloration during an appointment for an unrelated matter, further testing revealed early-stage kidney disease. The discoloration wasn't due to poor hygiene itself. Rather, the infrequent bathing had hidden a critical symptom that could have been spotted weeks earlier. What's the solution? Establish a regular bathing schedule at least 3 times weekly, even if you're not particularly active. Use mild fragrance-free soap that won't strip your skin's natural oils. After bathing, apply moisturizer while your skin is still slightly damp to lock in hydration. And most importantly, regularly examine your skin for unusual changes in color, texture, or sensation. Are you noticing dry, flaky patches? Unusual discoloration? Areas that itch persistently? These could be your body's way of alerting you to something much more serious happening internally. Don't wait another day to address these warning signs. Mistake number 3. Ignoring nail care. Take a moment right now to look at your fingernails and toenails. What do you see? Are they neatly trimmed, clean underneath, free from discoloration? The condition of your nails is a window to your overall health that doctors check immediately when evaluating elderly patients. According to the American Academy of Dermatology, nail changes can indicate over 20 different systemic diseases, from anemia to thyroid issues to heart disease. Their research shows that in patients over 65, nail abnormalities led to the diagnosis of previously undetected internal conditions in nearly 30% of cases. Let me share Eleanor's story. At 82, Eleanor didn't think her thickening, yellowing toenails were concerning. She simply stopped wearing sandals and hid them in closed shoes. "I figured it was just part of getting older," she told me. But when she finally saw a podiatrist for foot pain, the doctor immediately diagnosed a fungal infection that had been allowed to flourish for so long, it revealed her severely suppressed immune system. Further testing uncovered a serious underlying condition that required immediate treatment. What should you do today? Trim your nails regularly straight across with slightly rounded edges to prevent ingrown nails. Keep them clean and dry. Wear breathable footwear and change your socks daily, and never ignore changes in nail color, texture, or thickness. These aren't cosmetic issues. They're potential warning signals from your body. Are your nails brittle, discolored, thickened? These changes aren't inevitable parts of aging. They're your body trying to tell you something important. Will you listen before it's too late? Mistake number 4. Improper incontinence management. This is perhaps the most shocking hygiene mistake because of how common it is and how desperately people try to conceal it. Over 50% of seniors are silently dealing with some form of incontinence. But the truly shocking part is how many hide it instead of seeking proper treatment. Urologists from Johns Hopkins Medicine report that untreated incontinence leads to dangerous skin infections, false social isolation, and can mask serious conditions like bladder or prostate cancer. Their studies reveal that seniors who properly manage incontinence issues have 60% fewer complications than those who attempt to hide the problem. Take Franklin, a 73-year-old retired accountant from Arizona. Franklin was too embarrassed to mention his occasional leakage to his doctor. He used paper towels and changed his clothes frequently, thinking he was managing the problem. When he finally sought help after developing painful sores, doctors discovered an advanced prostate condition that could have been treated months earlier, with much better outcomes. "My pride nearly cost me my life," Franklin admitted. "I wish I had talked to my doctor at the first sign of a problem instead of trying to hide it." What should you do if you're experiencing any form of incontinence? First, never be embarrassed to discuss bladder issues with your doctor. They see this every single day. Use proper absorbent products designed specifically for incontinence, rather than makeshift solutions. Change promptly when wet and follow a proper cleansing routine to prevent skin breakdown. Most importantly, recognize that incontinence is not a normal part of aging. It's often a symptom that something needs medical attention. Are you experiencing occasional leakage? Finding yourself planning outings around bathroom availability? Using makeshift protection? Don't wait another day to speak with your doctor about these symptoms. Your health and possibly your life may depend on it. Mistake number 5. Ear hygiene errors. What's your ear cleaning routine? Be honest with yourself. Are you using cotton swabs, inserting them deep into your ear canal? If so, you're making a dangerous mistake that many seniors make every day. Many older adults are damaging their hearing and missing signs of serious infection due to improper ear cleaning. Otolaryngologists at the Cleveland Clinic have highlighted the dangers of self-cleaning ears with cotton swabs while missing symptoms of potentially dangerous infections. Their research shows that improper ear cleaning is responsible for nearly 40% of ear canal injuries in patients over 65, with many cases leading to infections that could have been avoided entirely. Let me tell you about Penelope, a 71-year-old retired librarian from Washington State. Penelope regularly used cotton swabs to clean deep inside her ears until she punctured her eardrum, leading to a severe infection that spread to nearby tissue. I had always cleaned my ears this way, she explained. No one ever told me it was dangerous. Penelope required emergency treatment and suffered permanent hearing damage that could have been completely avoided. What's the correct approach to ear hygiene? Remember this simple rule: never insert anything smaller than your elbow into your ear canal. Clean only the outer ear with a warm, damp washcloth. If you feel you have excess wax, use ear drops specifically designed to soften wax, following the package directions precisely, and see a doctor immediately if you experience pain, discharge, or hearing changes. Are your ears itchy, feeling full or blocked, experiencing unexplained hearing changes? Don't attempt to resolve these problems yourself. They require professional medical attention. Your hearing is precious. Protect it with proper care. Mistake number 6, poor foot hygiene. When was the last time you really looked at your feet? Not just a passing glance, but a thorough inspection of every part. Between the toes, the heels, the soles. Your feet contain vital clues about your circulatory and nervous system that doctors check first in elderly patients. Podiatrists specializing in geriatric care at the American Podiatric Medical Association state that foot hygiene issues often reveal the first signs of diabetes, neuropathy, and vascular disease. Their studies show that in patients over 65, proper foot care and regular inspection could prevent up to 85% of diabetes-related amputations. That's not a typo. 85% of amputations could be prevented with proper foot care. Consider Raymond, a 76-year-old retired factory worker from Illinois. Raymond ignored the dryness and minor cuts on his feet, assuming they were just normal signs of aging. My feet had been looking rough for years, he admitted, but when his doctor noticed them during a routine exam, he immediately ordered diabetes testing, catching the disease in its early stages, when lifestyle changes could still make a significant difference. If my doctor hadn't checked my feet, I might have gone years without knowing I had diabetes. Raymond told me, by then the damage would have been severe. What should you do starting today? Wash and thoroughly dry your feet daily, especially between the toes where fungus loves to grow. Inspect them regularly for cuts, sores, or changes in color or temperature. Wear clean, dry socks made of natural fibers or moisture-wicking materials. Apply moisturizer to dry areas, but not between the toes, and never ignore pain, numbness, or wounds that don't heal. See a medical professional immediately. Are your feet dry and cracked? Notice any cuts that aren't healing properly, any unusual discoloration or loss of feeling. These aren't just cosmetic issues. They could be early warning signs of serious conditions that need immediate attention. Mistake number 7, medication-related hygiene issues. Are you taking multiple medications? Have you noticed changes in your body odor, sweating patterns, or mouth dryness since starting them? The medications keeping you alive might be causing hygiene problems that signal dangerous side effects. Pharmacologists at the American Geriatric Society have documented how certain commonly prescribed medications cause dry mouth, excessive sweating, or body odor changes that indicate potential toxicity. Their research shows that nearly 40% of adverse drug reactions in seniors present first as changes in personal hygiene needs before more serious symptoms appear. Take Beatrice, a 67-year-old retired nurse from Florida. Beatrice's unusual body odor was dismissed by her family as poor hygiene until her geriatrician recognized it as a sign of medication toxicity that was slowly damaging her liver. I was showering regularly and using deodorant. Beatrice explained, I had no idea the smell was coming from inside my body, not from lack of cleanliness. What can you do to protect yourself? Track all hygiene changes after starting new medications. Keep a simple journal noting any differences in body odor, sweating, mouth dryness, or skin changes. Stay properly hydrated unless otherwise instructed by your doctor. Report unusual sweating or odor. Changes to your doctor immediately, as these could indicate dangerous drug interactions, and never adjust dosages without medical supervision, even if you think the medication is causing hygiene issues. Have you noticed unusual body odor despite regular bathing, excessive sweating, extreme mouth dryness? Don't attribute these changes to normal aging. They could be warning you of potentially life-threatening medication effects that need immediate attention. Now you know the 7 critical hygiene mistakes that doctors immediately notice in their elderly patients, and exactly how to correct them. By addressing these issues today, you can prevent serious health problems, maintain your dignity and independence, and potentially add years to your life. Remember, proper hygiene isn't just about appearance or social courtesy. It's a vital part of maintaining your health as you age, and these simple changes could literally save your life. A valuable lesson. The subtle signals our bodies send through seemingly minor hygiene habits should never be ignored, especially as we age. Paying close attention to these details and communicating any changes to your healthcare provider can be a powerful tool in early disease detection and prevention. Your body is constantly communicating with you. It's crucial to listen. Did your doctor ever notice any of these hygiene issues during your visits? Share your experience in the comments below. Don't forget to subscribe to our channel and hit the notification bell to receive more potentially life-saving health information like this. Please rate this video on a scale of 1 to 10, and please share this video with your loved ones who are over 60. This knowledge could literally save their lives.